Hi, my name is Lindsay and I will be demonstrating how to properly obtain a blood pressure reading. Did you know that in the United States, almost half of all adults suffer from high blood pressure? High blood pressure can lead to many other illnesses, including strokes, heart attacks, and the number one killer of all Americans, heart disease. Blood pressure is the force of your blood against your blood vessels and is interpreted by two numbers. The first number is called systolic and the second number is called diastolic. The systolic is the pressure of your blood against your arteries when your heart is beating. And the diastolic is the pressure of your blood when your heart is resting between the beats. A normal systolic blood pressure should be between 100 and 130, and a normal diastolic should be less than 80. It is very important to know what your blood pressure is and to take the necessary steps to lower it. To obtain a blood pressure, you will need a stethoscope and a blood pressure machine, also known as a sphygmomanometer. Before beginning, the person should be relaxed for about 5 minutes, and you should make sure that they have not drank coffee or any caffeine, smoked, or exercised for at least 30 minutes before. Make sure the back is straight and the legs are not crossed and the arm is supported on a flat surface. Wrap the cuff of the machine around the person's arm above the elbow. Place the stethoscope in your ears and over the crease of the person's arm, also known as the brachial artery. Squeeze the pump to inflate the cuff until the gauge is at about 160. Slowly release the air from the cuff by turning the nozzle left to loosen. The first beat that you hear will be the systolic, and the last beat that you hear will be the diastolic. I have obtained a reading of 110/76, which is a normal blood pressure reading. The best way to lower your blood pressure is to make some lifestyle changes, such as maintaining a healthy weight and by exercising regularly and eating a balanced meal that is low in salt. Some other ways to lower blood pressure is by getting rid of unhealthy habits such as smoking and limiting your consumption of alcohol. If you receive an abnormal blood pressure reading, you should call your doctors to schedule an appointment, since medications are also used to control high blood pressure. If a high blood pressure reading is accompanied by shortness of breath, dizziness, or chest pain, it may be best to call 911, since this may be life-threatening. Thank you for watching my video, and I hope you have learned something new today.